Type 1 diabetes. Type 1 diabetes is an autoimmune disease that typically develops during childhood or adolescence. In people with type 1 diabetes, the immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas, called beta cells. This leads to a lack of insulin in the body, which causes high blood sugar levels. The exact cause of the autoimmune response is not known, but genetics and environmental factors are thought to play a role. Researchers have identified several genes that may increase the risk of developing type 1 diabetes, but not everyone with these genes will develop the condition. Environmental factors, such as exposure to viruses or other environmental toxins, may also trigger the autoimmune response. Type 2 diabetes is the most common type of diabetes, accounting for about 90 to 95% of all cases. It typically develops in adulthood, but it is becoming increasingly common in children and adolescents due to the rise in obesity rates. Type 2 diabetes occurs when the body becomes resistant to insulin, meaning that the cells do not respond to the insulin that is produced. This causes the pancreas to produce more insulin to try to compensate, which can eventually lead to a lack of insulin in the body and high blood sugar levels. The exact cause of insulin resistance is not known, but obesity, lack of physical activity, and an unhealthy diet are all thought to play a role. Genetics also play a role in the development of type 2 diabetes, with certain genes increasing the risk of the condition. Other risk factors for both types of diabetes include age, ethnicity, gestational diabetes during pregnancy, and polycystic ovary syndrome, PCOS, in women. As people age, their risk of developing diabetes increases, with the highest rates of the condition seen in people over the age of 65. Certain ethnic groups, such as African Americans, Hispanics, and Native Americans, are at higher risk of developing diabetes. Gestational diabetes occurs during pregnancy and can increase the risk of developing type 2 diabetes later in life. PCOS is a hormonal disorder that affects women and is associated with insulin resistance and an increased risk of diabetes.